Hey, welcome back, Energy Physio, talking about patient number 1. It's not the first patient I ever saw. It's not the only patient I ever saw. We're just going from 0 to 1 to 2, and we're going to keep on going until we get into the millions, I suppose. But next patient comes in with hip pain. Random connection through another therapist. She was on the north. This patient was way on the south. I happened to be right in between, a little more convenient. Met for coffee. Good business connection. It's been a lot of fun working with this person. We continue to work together. But she comes to me, we're having business conversation, mentions, hey, I'm scheduled for hip surgery next week. What? Anytime I hear that, my immediate thought is, you don't need surgery. Sure enough, she didn't need surgery. Here's the deal. Went to the doc with hip pain. This patient is an avid runner. You can imagine how frustrating hip pain must be when you go from running half marathons, full marathons, running lots of thons, and then having so much pain that you can't run at all. Can you imagine how frustrating that would be? All you lifters out there, you get hurt and can't lift, life is no good. Time to get something fixed. And when people get desperate, they make terrible decisions. Man, can't imagine, man, if I couldn't do the things I wanted to do for long enough, I would do anything, including surgery, especially if nobody's telling me any different, right? So, hip pain, has some injections, don't work. Sees the doc multiple times, nothing's changed. Goes to therapy, has not really good results in therapy, maybe some minor benefits, but here's the deal. She's talking me through all the things she's been doing in therapy, a lot of strengthening. The hip hurts, so if you've been in therapy for your hip, you know exactly what I'm about to say. Straight leg raise, prone hip extension, side-lying hip abduction, clamshells till the cows come home, monster walks, okay? So just blasting this thing with strengthening over a joint that doesn't work right. So you can imagine the results are minimal, okay? Pain doesn't come from weakness. I've seen 98-year-old women who are weaker than skim milk who don't have pain. They have limited function because they're weak. They can't get out of a chair because they're weak, but they don't have pain. And I've seen dudes who can lift the frickin' truck just brutally strong, and they got pain everywhere. Why are we equating weakness to pain? It doesn't make sense. Stop doing it. And so blasting a joint that's painful with therapeutic exercise over and over and over, not going to get a good result, okay? This surgeon was ready to put this patient under the knife without doing a thorough movement evaluation and hip screening. And what do I find is patient number 1, their pelvis is out of whack, totally cranked out of position. This does a lot of weird things to the hip joints on both sides. Particularly, her right hip was hurting, and typically when the pelvis moves, it rotates forwards and closes the joint down. So you get a lot of anterior joint pain, which then can radiate out to the side when your labrum gets a little bit dicey. Anyway, pelvis was out of whack. Not only that, but her hip joint capsule was insanely stiff, as well as her ankles. So we're about to go in and do surgery on a joint that already doesn't move well, which, in case you were wondering, those don't rehab very well either because it takes forever. If you got a stiff joint going into surgery, you got an even stiffer joint coming out, and it's likely that it takes forever to get that joint moving appropriately after surgery. Anytime you have pain, once you have pain, you got some complex problems already. Even if pain is minor, you got muscle disruption, fascia disruption, joint disruption, movement disruption, control disruption. So pain is never just pain. Forget it. But if you got a stiff joint going into surgery, you got an even stiffer joint coming out. After you have surgery, you got a laundry list of problems. Pain, swelling, stiffness, immobility, decreased nerve function, decreased muscle function. The list goes on. And then you got to solve all those problems after surgery when you just had a couple to solve before surgery. Anyway, she was going into surgery, and no one had ever thought, oh, you know what? I wonder if her hip moved like a normal hip, if her pain would go away. You know what? It did. It did go away. We restored her flexion, which was limited by about 30 degrees. We restored her external rotation. We're still working on it, but she was hanging around 25, 30 degrees. And the hip really needs about 90 degrees of external rotation in flexion. She had negative, I was going to say zero, but it was negative hip extension. So for a runner, zero hip extension, you need 30 degrees, you got zero. Where's all that stress going? Internal rotation, 20 degrees, we want 40. So we got a hip that can't even move right, trying to strengthen a hip that can't move right, expecting pain go away, and it's no problem this patient was scheduled for surgery. What's she going to do? Man, I've been doing therapy, I've done injections, nothing's working. My pain must be from some structural problem. Well, we started chipping away at the mechanical issues around the hip. We put the pelvis back where it goes. We worked some mid-back to get the mid-back in a little better position because all that tissue affects the way the hips and pelvis move. We restored ankle mobility so when she runs, her stiff brick ankles aren't cramming her hips up into her pelvis. And voila, no surgery. She was scheduled the next week. Got her feeling good enough in one session that she put it off, hadn't done it yet. Don't expect her to do it for a long, long time. So another example of how misdiagnosing and not looking at the whole picture can lead to some crappy outcomes. We got to quit it. Okay? If you're a therapist, a new therapist, an old therapist, you got to have good system-wide approaches to understand how the body moves as a whole, but not just to understand weakness. Muscles are kept by the joints. If the joint's out of whack, the muscle's out of whack. Of course, if a joint doesn't work, the muscles are going to be weak around it. Don't think you can strengthen over a crappy movement pattern and expect a good result. We got to have good systems for do our joint moves fully and appropriately and have all the requisite positions for functional movement. If they don't, you need to fix them. If you go into surgery and you don't have prerequisite functional movement mobility, surgery doesn't matter. You're coming out with the same problem you had before. Your pain's going to go away because you were forced to rest for 6 to 8 weeks. Your pain probably would have gone away if you just, went on bed rest for 4 to 6 weeks, 8 weeks before you had surgery. Surgery makes you rest. It forces you to rest. And of course your pain goes away because you rested. Ultimately, you get back to normal business. You still got the same mechanical restrictions you had before surgery. 6 months later, you got the same pain, and you re-enter the same crappy healthcare cycle that you started with. Don't do that. Let's figure it out, people. See you later.